My goal right now, after coming on board in October of 2010, is to really put California on the map as respect to Next Generation 911. And not just that, being the first out to implement Next Generation 911, but to actually do it right, to reach out to our stakeholders across the state, to the public, to our dispatch centers, and to all of our stakeholders. So that's what we're trying to get from these public meetings. I want to go over current 911 environment, what California is doing to transition to Next Generation 911, and as we roll out 911, what might that look like in California, and just to show that California is falling behind what they have at the national level. Currently in California, you'll see by the stats that we're not like Rhode Island, we're not like Texas, we're not like Michigan. We are California, and we have a lot of residents to take care of and to make sure that they have access to 911. We also have demographics across the state that are unique and really need to take into consideration the amount of visitors as well as just our citizens that come to California that will need 911 services. So in 2010, we have 37 million residents. That's not including all the visitors that I spoke of. We cover about 163,000 square miles, go from the deserts all the way up to the mountaintops. This office oversees 465 PSAPs statewide, which are the public safety answering points, otherwise known as the dispatch centers. We answered 23.8 million calls, 911 calls last year, and that attributed to all of the dispatchers, communication supervisors, and also the first responders that are responsible for all the public safety in California. 16.6 million of those calls were wireless, and that shows a trend that we're moving from wireline technology to the wireless and giving mobility throughout California across those 163,000 miles. We have to ensure that when somebody is in a part of the state that they have access to 911 and that we can actually get that call to a dispatch center and get first responders rolling. On any given day, there are 65,000 911 calls in California, and when you compare some of these stats, 465 PSAPs, some states have 39, some states have 6. So it kind of shows the magnitude of what we're doing in California. And because of our demographics, for 911 calls, we translate those into approximately 91 different languages. So as we expand our capabilities for 911, we also have to consider what we're going to have to do as far as when text messages or video. We have to make sure that we're realizing what the demographics of California are. As Jeremy mentioned, the current California 911 environment, we don't have the infrastructure, or the legacy infrastructure doesn't allow for processing of the newer technologies. We don't have capabilities for text messages, videos, or photos. We're unable to deal with call congestion and backup capabilities outside of local jurisdictions, so we're not able to automatically or dynamically transfer those calls based on business rules. And the location accuracy needs to be improved. We want to really make sure that the call goes to the right PSAP the first time. So that location accuracy is really important to us when routing 911 calls. And as Kimball graphically represented the essential elements to Next Generation 911, current Next Gen 911 efforts in California are also following that same model. We want to make sure we have some current efforts underway, starting with the strategic plan that was published last year, July 2010, with 3 major themes in that strategic plan, one being heavily weighted in Next Gen 911, making sure that we are collaborating and reaching out to our key stakeholders statewide. And the public education and outreach component is making sure that we let our citizens know when and how to interact with 911 and when to call for emergency services and use that 911 number. At the end of last year in December, we conducted a statewide PSAP Next Gen survey across the state. We wanted to make sure that we understood from a PSAP's perspective what the issues were, what the concerns are, and also what obstacles they may face or just what's on their mind. We also published the proposed California NextGen 9-1-1 Roadmap. That is our tactical approach to NextGen 9-1-1 and kind of identifying all the elements that we need to put into place and implement when we roll out this technology and process and capability across the state. And then we're also conducting February, March, this is our last one, the 6 public meetings, and that includes, we spanned from Northern California all the way down to Southern California and reaching out to the public to make sure that we gather the comments and we identify if there are any gaps or things that we didn't think about in our roadmap and include those as we get NextGen underway. So as Jeremy had mentioned, those components for NextGen, we're also considering the regulatory legislative funding mechanism in California, which is the CETNA fund. That is the statewide emergency telephone number account, and that is what funds based on a surcharge tax on each phone in California. That's what funds the infrastructure to move towards and provide 911 services. One of our first initiatives and the technical foundation of NextGen 9-1-1 is really, or is going to be, and is our E911 grant project. That's going on currently right now in the northeastern part of California. Our time frame, we started in September 2009, and we will conclude the project in September 2012. We have $8.6 million in federal and state matching grant funds to carry out this project, proof of concept for NextGen 9-1-1. And as of December 2010, we have 3 PSAPs, Gridley, Oroville, and Paradise Police Department on the IP hosted solution. And I believe this week we lit up another site, which was CAL FIRE in that area. Some other preliminary NextGen 9-1-1 efforts that are underway are Imperial County, Ventura County, Pasadena, and Mendocino County areas where we're in different phases of those projects, starting initial planning and discussions and making sure that when we put these hosted solutions in, we're picking the right solutions and we're understanding the business needs across California as well as at the PSAP and dispatch center level. This slide you'll see many times, maybe today or just as people talk about NextGen 9-1-1. We wanted to represent that California is following in the steps of what the federal government and industry see as moving towards NextGen. And as you can tell, where we rely on voice calls today, in the next generation environment, we're going to be moving to voice, text, and video capability all in the one system. We're going to have advanced data sharing capabilities across PSAPs. We're going to be routing callers dynamically based on the location of an individual and call congestion across the system. And also be able to deal with dynamically rerouting of callers when there's potential outages and the inability to answer 911 calls. And I want to wrap up my presentation as really a call to action. The state of California is looking to engage, participate, and share the input with all of the stakeholders and the public throughout the state. We are concluding these public meetings today, and attached to that public meeting notice are 15 questions spanning on what the state of California wants to know and incorporate into the NextGen solution. Those comments are due from the public, stakeholders, and industry on March 18th. So just in a couple of weeks, and I'm asking that everybody weigh in on those, look at those questions. You don't have to answer all of the questions. If there's one area of interest, go ahead and submit your comments according to the instructions on the public meeting notice.
My name is Jeremy Smith, and I'm a senior consultant with L.R. Kimball, a company that has helped the state of California recently develop their NG9-1-1 Roadmap, which some of you may have seen. In addition to working with California, we've been fortunate enough to work with several different states across the country and are involved in a lot of different activities related to NextGen 911. And so that sort of gives us a unique perspective on what's going on at the national level. And we thought that it would be useful to share some of that information just to give you a little bit of perspective on the rest of the world. Ryan Doolin will be talking a little bit about California specifically immediately after this. You heard Karen mention this morning that 911 is not broken, and I think it's important to note that. Sometimes folks might get the impression that 911 is broken, because it can't text or you can't receive text for 911, et cetera. And that isn't true. 911 is not broken. But it's important to know that 911 really wasn't designed with those kinds of technologies in mind. It was primarily designed to receive 3-digit dialing from landline. The addition of technologies like cell phones, and Ryan will actually probably have some statistics to show you the number of wireline calls versus wireless calls in California and how that scale is tipped a little bit, or quite a bit. But with the addition of wireless calls, there were some modifications that needed to be made to the network to identify location and things like that of the caller. The introduction of voice over IP, your Vonages of the world and things of that nature, also required some modifications. Again, this is sort of the square peg round hole. But the system as it designs today, the underlying technology of the 911 system, really isn't extensible to support the new types of technologies that my almost 16-year-old daughter wants to use to communicate with 911. Texting, video, and those kinds of capabilities, and even some of the capabilities that the gentleman from OnStar talked about, the ability to send that data directly to the PSAP. The underlying 911 network really doesn't provide a means for us to support that. And so there is a need to update the legacy 911 network with what we're calling Next Generation 911. So what is Next Generation 911? Well, there's a lot of different definitions of Next Generation 911, and for our purposes here, Next Generation 911 is an open standards-based system that really is designed to allow just about any type of device to communicate with 911. Now, any device is kind of a broad statement. Obviously, there needs to be some sort of parameters and standards in place that define what types of devices, how they communicate. But the theory is any device, any time, as you'll hear the National Emergency Number Association, or NENA, talk about. A lot of times folks will make the mistake of thinking that NextGen is just a network, that all we need to do is put an IP-enabled network in place and connect all the PSAPs together, and voila, we have NextGen 911. And while a network is very important to NextGen 911, it's not the only thing. In fact, if you look at the graph to the left, you'll see that the circle on the inside is some of the technology, whether it's your applications that need to be updated to support Next Generation 911, or your security, which will now need to be updated because we're all connected together now, and so we have security risks. Your network, that's kind of the easy part, frankly. The outside circle, though, that's the more difficult piece. You know, the fact that OnStar and ATX can deliver that information to the PSAP is an exciting kind of capability, but what do those call takers do with that information? How do they process that information? How do they determine what exactly they need to do with that when all they're used to doing is just taking a 911 phone call? Understanding the operational impact is critical. Understanding the governance, or how decisions get made when you now have multiple 911 call-taking centers, multiple PSAPs connected together, a fire station, a highway patrol facility, and the local sheriff's department. 3 different governmental entities. Who makes decisions, and how do those decisions get made in this model? How does everybody ensure that we're protected? Governance is certainly one of the issues that can certainly be very sticky. And there are a lot of other concerns. But Next Generation 911 needs to contain all of those functions that we're used to, those rock-solid functions that we're used to in the legacy 911, while allowing for those new features that we need in our new environment today. There is no formal mandate. There's no law, there's no requirement that says NextGen has to be implemented. But consumer expectations, my almost 16-year-old daughter, who I was teaching to drive the other day, That's a different story. But you know, they're the folks that are driving this adoption. Certainly technological advances are driving this as well. The capabilities like you see from OnStar and ATX, the capabilities in the cellular devices, in the phones that we see, you know, there's an app for that, right? There's always an app for everything. All of those capabilities are driving us towards next generation 911. I think it's important to note, though, that next generation 911 is still in development. The standards are still being developed today. There are no fully deployed next-gen 911 systems yet. There are partially deployed systems. Some folks, and I'll talk a little bit about this in a minute, have started to deploy various elements and are in various stages of the planning process. Recently, the FCC released a notice of inquiry asking the public for comment, and so you started to see some activity at the national level as well. Many states, and I'll give you kind of an update on this in just a second, are already creating their strategic plans, their roadmaps, their security plans, their operations plans, the plans on what to do with their data, which is so critical in determining things like location in a next generation 911. Next generation 911 networks, those networks that are capable of supporting it, those IP-enabled networks that will be used to communicate, to put all this data and information on, can start to be implemented as well. And I'm hoping that you guys can see these okay, but there's a couple of maps here, and I wanted to just kind of show you. As I mentioned, we have the opportunity to work with a lot of different states and have kind of a national perspective. And we'll take the one here on the left, the Next Gen 911 planning slide. You can see that the states that are in green are states that have started to do some sort of planning across the United States. And you can see that California is also a part of that. The states in white are those that have not started that process yet. If you look at the slide to the right there, the started to deploy, these are states that have started to deploy some element of Next-Gen 911, be it a network, be it a partial network, be it some sort of test bed or grant project or something like that. And you'll see that California is in kind of that lime green. That's because a sub-state has been, a portion, not in the entire state, but just a sub-state has been deployed with the Northeast Grant Project, which is actually happening up here in this part of the state. And you can see that there are several states that while they've started the planning process, they have not started to deploy anything yet. So sometimes folks will ask me, is California behind or ahead of everybody else? And I would say that you're right in the middle. You're not ahead, you're not behind. You're right in the middle. I think that this slide is probably the most telling slide, and that's the fact that nobody in the country has implemented a fully next-gen 911 deployment yet. Not yet. Now, who will be first? It'll probably end up being somebody like Rhode Island or Connecticut or something like that. It probably will not be California, but I get the sense that you guys probably won't be far behind here. So what are some other states doing? We could spend hours talking about a lot of the different things that states are doing. I thought that I would talk about two in particular and then just hit a highlight on a few other states in a minute. But Texas is a state that has been doing quite a bit on NextGen. They have gone so far as to release what's called a master plan, which is sort of their definition of NextGen 911 for their state. It describes the architectural model by which they are going to deploy NextGen. What they have chosen to do in Texas, for those of you that aren't familiar with the Texas environment, the way that the state of Texas handles 911 is based on regional groupings. There's a couple of different governmental entities that are used to segregate 911. There's a state 911 office in Texas which is responsible for only a portion of those, and then a bunch of the other organizations kind of do things on their own. They've managed to come to the table and for the most part get along and have created a design whereby there will be regional next-gen 911 networks, or what we call ESI nets, or emergency services networks, that will then be connected by a statewide network. And so they're pretty far down the planning process. If I had to pick a state that was the farthest along, I would probably say that it's Texas. That's probably the farthest along. Michigan has done quite a bit of work. They've conducted some research on existing networks that Michigan has in place. They've started to define their functional requirements. So what is going to define NextGen 911 in Michigan? They've started to define those requirements. They've done some cost studies to figure out how much it's going to cost to do NextGen in Michigan. Oregon is doing this right now, trying to figure out what it's going to cost to do NextGen in the state of Oregon. And they've started to put together their strategic plan or strategic report to lay out just how it's going to be constructed in the state of Michigan. A couple of other states, Minnesota has an IP-enabled network, Tennessee, and I'm just briefly hitting the highlights here with respect to time, but Tennessee has been integrating with another state network. You'll notice there's a theme of at least looking at existing state networks. Sunk cost has already been put into a state network in a lot of these places, and so they're finding that there's political will to at least examine those networks for suitability. They may not and ultimately end up using those networks, but they're wanting to be prudent with their funds and take a look at those networks as they exist today. Colorado started the planning process. Washington has completed the planning process and has started some pilot projects. So again, while there is no formal mandate for NextGen 911, the consumers are driving it. The folks that have OnStar in their car, they're saying, hey, we have all this information. Why can't the PSAPs receive it? My daughter says, why can't I text 911, Dad? And it's a technical explanation, which she tunes out pretty quick. But this technology is moving along fairly rapidly, and it is time to migrate our legacy 911 environment to NextGen.
Since 2007, I've had the pleasure of assisting the 911 office, and more recently the CIO, on a variety of questions concerning the regulations and rules of the PUC. I think I'll take a clue from Lisa and not read everything on my slides, and certainly my intention is not to go into great detail, but to contribute an overview of the California Public Utilities Commission's regulatory program and policies. My presentation is built around the questions that are raised in the Next Generation 911 Roadmap. And the roadmap recommends an assessment and analysis which includes the following objectives. California must fully understand the elements comprising today's 911 system. It should review, assess, and analyze current regulations and tariffs that impact 911 service. And it is important that the regulatory environment provide competitors with the same reasonable and non-discriminatory treatment as incumbent service providers. I hope to provide some information that addresses two main questions. One, do regulations limit the ability of the state to enter into a contract or service level agreement for 911 services? And do regulations restrict the ability of new competitors to provide 911 services? Regarding utility tariffs, it's important to note that the Public Utilities Code, and not a tariff, defines the carrier's duty to provide access to 911 at no charge to the caller. Public Utilities Code consists of laws passed by the legislature and not by the PUC, contrary to popular belief. Tariffs, on the other hand, are documents authorized by the PUC that contains rates, terms, and conditions associated with services that are offered to consumers. Tariffs provide standardized terms and conditions that apply to all customers, and tariffs also offer an alternative to lengthy competitive bidding process, a benefit recognized by the 911 office in the past. Finally, the PUC issues rules governing tariff filing and posting. These rules include public notice to customers and competitors, which provide the opportunity for parties to object and for review by the PUC. California's first E911 tariff was filed by Pacific Bell in 1989. This was done at the request of the Department of General Services to simplify the administration of service, and to transition from 212 separate contracts that Pacific Bell had with PSAPs. The proposed tariff reduced rates 18% or $4.5 million annually. When the PUC approved this tariff in 1990, its policy was based on the absence of competitors able to offer the service. As a result, the PUC decided that 911 tariff rates should be compensatory, but as close to cost as possible, and required cost support for review by PUC staff. Although the PUC relaxed regulation of competitive services in 2007, that decision specifically exempted E911 tariffs. Last year, we, staff, cited this commission policy to request updated cost support for 911 tariffs of 2 ILECs. That review resulted in new rate reductions and annual savings of $513,000 to the 911 program. Major 911 tariffs filed with the PUC include those filed by AT&T and Verizon for the 911 network, for database storage and retrieval, and for the delivery of 911 calls from wireless and VoIP service providers. Other tariffs utilizing the 911 database include PSLE service for PBX phone stations and database downloads used for emergency alert systems that are run by counties and cities. California's other ILECs also have tariff rates for 911 circuits and for the provisioning of their subscriber information in the 911 database. The PUC has long recognized that circumstances may exist to justify the providing of service at rates, terms, and conditions outside of a tariff. Contracts reduce the regulatory burden and provide more flexibility for the negotiating parties. Thus, tariffs can act as placeholders for individual contracts. Contracts are also known as ICBs, an abbreviation for individual case basis. ICB terms and conditions can refer to governing tariffs, or the contract can set forth the entire understanding of the parties, respect to the service, and supersede any other tariff of the service provider. California's 4 largest ILECs and all CLECs have full pricing flexibility as to contracts for tariff services. Contracts are not subject to price ceilings or floors, go into effect upon approval by both parties, and cannot be suspended. New telephone corporations or competitors must be certified by the PUC before placing a telephone line in service per Public Utilities Code Section 1001. However, wireless carriers are exempt in that they simply register with us. Before granting a certificate of public convenience and necessity, the PUC must verify both the financial viability of the applicant and that the officers of the corporation have no prior history of committing fraud in the public. Our Consumer Protection and Safety Division reviews new applications and has objected to some applicants due to prior bad acts in other states. Filing the tariff is one of our requirements, but our policy permits a new CLEC to adopt the AT&T tariff with the right to set pricing on an ICB basis. As far as liability, CLECs cannot provide liability limitations more stringent than AT&T's terms found in its tariff. In conclusion, there is no PUC requirement for the technical interface or specific protocol for delivery of 911 calls. We typically allow carriers the freedom to deploy new technologies as long as they meet the demand of the market and the PUC's service quality requirements. The existing tariff regime does not prevent competitive 911 service offerings from new service providers. We believe that the 911 office has primary authority under the Warren Act and the California Government Code to establish mandatory 911 standards and service levels for its vendors. If there are unanswered questions regarding regulatory roadblocks or opening of the market to new competitors, a workshop involving industry input may be helpful in addressing specific questions and issues. I hope this review has been informative and provides a foundation for going forward. Thank you.
Good afternoon again. My name is Shelby Geezer. I've been a 911 county coordinator for the past 4 years, and again, I'm a member of the County Coordinator Task Force. I am here to talk to you about the PSAP's point of view regarding the Next Generation 911. What does Next Generation 911 mean to the 911 dispatchers, 911 call takers? Because that's what I'm here to represent. I don't represent just the PSAP, I represent the dispatchers. What does Next Generation 911 mean to them? Has anybody asked a dispatcher what that means? I have. I asked, and I got a lot of blank stares. So we have a long way to go when it comes to educating and teaching our dispatchers what's to come and how it's going to affect their job functions. Because today, as we know it, the majority of them don't quite understand what's coming down the pike. Okay, any device, anywhere, anytime. We talked about real-time texting, or real-time text, which is tweeting, blogging, short message service, which of course is texting. There's also instant messaging or email. Other modes of text communication would be still photos, text videos, and of course analog gateway, which is the regular phone lines. All of these are included in the next generation brainstorming. Everyone's talked about the texting and the messaging, and I've heard about the emailing and the blogging on networks such as Facebook and MySpace. But could we, at a PSAP level, utilize Facebook for a 911 solution? One other possible solution that I know of personally is reverse mass calling. In my county recently, we used what we call Alert TC, which is a reverse 911 calling. We had a major power outage in one of our courthouses, and we used that mass calling technique to contact every employee in that courthouse to let them know what was going on. Could that be one of our solutions that may be out there, that our 911 system could possibly do that to our cell phones, to our Android devices that we hold in our hands today? That's something that's out there. NextGen 911 is limitless. However, when it comes to a PSAP point of view, there's a lot out there that needs to be brought down to us, to our level, so that we understand what's coming in. What does Next Generation 911 mean to the public? Or a better question is, what does the public expect from 911 Next Generation? The public expects one number, any device, anywhere. They want to know that they can pick up a phone or any device they have in their hand and dial 911, it's going to get them the help they need. They don't want to know what's going on behind the scenes, they just want to know that they have help out there. So let's talk a little bit about history of technology. Starting about 20 years ago, there were the bag cell phones. After that, the big brick cell phones. And then the Motorola flip phones. And then, of course, now we have Androids. So what we're dealing with today may seem like huge issues to us right now, but in 10 or 15 years, our technology is going to be so far past all this, this will just be a minute point. But let's hope that we have the roadmap in place to make sure that we take our dispatchers and our call takers along with us on that ride. Okay, so I'm going to go over 5 issues that need to be addressed when it comes to PSAP point of view, or the dispatchers, the call takers. We have funding, legislation, technology, security, and what I think is the most important is education. Funding. Where are we going to get the money to fund this? If we're talking about hosted solutions for counties or regions, because really Next Generation is talking about having regional networks, where are we going to get the money to fund this? We're going to look at our state and our federal partners to help us out in this venture, but we also need to look at internally where are our departments going to come up with the money to fund the equipment, the technology that's going to take, and the education for our dispatchers, because not only do they need a one-time education, but they need ongoing education as the technology evolves. We need to start looking now at what's in place, and we need to start looking at how we can improve or work upon what's coming next. We need to make sure that we collect 911 fees from every single device, even phones that are pay-as-you-go. Any type of phone that's out there, we need to make sure that we're collecting 911 fees for those, because that's going to help fund the future. Legislation. Governance and policy will be essential for a smooth and successful transition to NextGen 911, and that is a very, very powerful statement, because it's very important. Not only is it important at a federal and a state level to have legislation and policy in place, but it's also going to be internal, because each internal agency has to have their own policies and their own procedures on how they're going to handle the maintenance and the education and so forth for all of their dispatchers. We need to figure out how we can all work together to make sure that everybody's on the same page when it comes to legislation, and that everybody knows what's going on, and we can all kind of come up with the same ideas and forethoughts for the future. And technology. How are we going to work with our partners in the software design? How are we going to make sure that the PSAP has a say-so in what's happening in the software design and so forth? Because we're actually going to be the ones that it's going to affect. We're going to be the ones working on it. We're going to be the ones accepting the calls and going through the videos and the messages and all the pictures that come in. It's us that it affects. So how are we going to make sure that the PSAP is involved in the technology? It's very important that the companies, the vendors, everybody is involved to make sure we come up with a good plan. For our dispatchers, it's very important that they have the ability to filter through text messaging or video messaging and make sure that it doesn't come in just automatically. Could you imagine a dispatcher taking a call of a traffic accident, and she's got 15 people calling in at the same time, and they're all sending messages and pictures, and she's having to decipher through each one of these pictures to look for pertinent information. You can imagine the chaos that's going on. So we have to be able to somehow filter these pictures and these texts so the dispatcher can actually pick what they need to see and what they don't need to see. Those are just little ideas that I thought of that we need to come up with, because a lot of people don't think about what the dispatcher's going through. They see the big picture, but they don't really focus in on the dispatcher. And security. Security is extremely important, especially nowadays, because we do have a lot of people where everybody deals with spoofing. Everybody deals with their identities being stolen, their computers cracked into, their credit cards being taken. When we're dealing with Next Generation 911, we're not just going to be sending generic information over the internet. We're going to be sending medical information, possibly employees' information. We're going to be sending caller information. It's very important that we work together to come up with an extremely secure network, because imagine if somebody cracked our network and was able to get everybody's medical information. That would be disastrous. There's many ideas floating around about what Next Generation 911 could possibly give us the capability of doing. We need to just make sure that as far as security is concerned, that everybody's on the same page so that we can come up with a really great and secure network. And education, which I believe is the most important point of them all. Of course, PSAP personnel, I spoke about earlier, we need to make sure that they are aware, they know how to process text messaging, they know how to do the call transfers, video, then be able to accept graphic pictures and be able to handle it and keep their composure and still help the caller on the other end. It's extremely important that they're educated because, like I said, they are, not only are they at the front line, but they're the ones that are getting the call, they're the ones that are deciphering what information is important and what is not. So education is extremely important, not only in the very beginning, but a continuous education. We also need to educate our first responders because hopefully with Next Generation 911, we will be able to not only at the dispatch center receive the pictures and the videos, but we will be able to forward those to our first responders who are on the way to a scene of an accident or a hostage situation or wherever it is that they're being dispatched to. Imagine the help that it would be to them if they could actually have a picture of the scene, if they could have a picture of the situation, if they could have a picture of the suspect. They would know what they're walking into, and it would give them a better tactical advantage, and I'm sure that they would be more prepared when they arrived on scene. And of course, the public, we need to educate the public. They need to be able to know what they can and cannot do. Misuse with 911 is going to be extremely important when it comes to the public. Not only do we need to educate them on what's available to them, we need to educate them on what they are not to do. And we also need to educate the application developers because they need to understand what the PSAPs are needing. They need to understand what the dispatchers need. Not just what is good for the region or the community, but they need to know what's good for the dispatchers. Thank you.
With today's technology, many people who are deaf, hard of hearing, have a speech disability, are still using texting, video phones, different types of technology, which means that many of them are using the TTY less and less. It'll never be completely done. No, it will never completely disappear. There will be some people that will still use it. Many people with speech disabilities are still going to use that type of technology. Some people will use other current, more modern technology like BlackBerry, high-speed things, because maybe their limited ability and different funds are very limited for them. Fortunately, with new technology, we see a lot of different things across the spectrum. Because many people are using technology today, texting, video phones, many different types of technology. One thing that we don't have is access to the 911 system. We do not have access to that, zero. Right now, we may have a phone, we may be able to text, but we're not able to call 911. We just had a situation that came up that a person hit their head in the car and they weren't able to actually call 911 for help. And there was no way for me to actually call to help. And it was very, very sad. January 26th, 1990, there was a law that was passed that we had to provide direct access to 911 by computer modem. We were to provide direct access via the 911 using the TTY and a computer. Now I want to talk a little bit about the way service is provided and a challenge that we are facing today and the TRS. There are two different types of relay services today. There is the landline and the internet. The traditional line would be the landline relay service we use to communicate with hearing people. We would use the TTY next. Traditionally, you would see the operator facilitating the communication. This is another type of video relay service that is provided to allow us to communicate with an interpreter on a screen, and the interpreter will then in turn talk and communicate with the hearing person, and they will facilitate the communication that way. Next. These are different types of technology that are available to us today. There is a wide range of technology. There's the VP phone equipment standalone. There's the mobile phone equipment, and then smartphone technology. So as you can see, we have a variety of different things available that we can use today. Next. We also use the IP relay, text-based, to communicate with the hearing people through using the technology, typing technology. We're going to talk about 911 internet-based relay calls. They are a challenge. This is a challenge that we are seeing here. As far as the Federal Communications Commission, the rules require that 10-digit numbers be provided so that they can call 911 through an internet-based relay service in order to be effective. And this was in December 31st, 2008. And what that means is that we are required to register with a provider, a preferred provider. For example, if I want to use a specific service to be my provider, I can register with them. So when I do dial into 911 and I place that call, I would be able to contact the relay provider, and that provider would then contact 911, and they would be in the middle facilitating the communication. And it's considered a third party. It's not considered a direct connect. Now, when I call 911 through the relay service, my caller information is supposed to be passed on to 911 center, and they should be able to see it there on their monitor, which will include my address, my phone number. It's supposed to. Also, sometimes the relay service, they may inform them and may attach some additional information for them on the screen for 911 that they would be able to call us back if we were disconnected. The average speed of answering a phone call, well, first, let me back up a little bit. There are 3 phone numbers to the 911 center. The first one would be the 911 emergency line, the trunk. The 10-digit number for the non-emergency, and then an administration line. Okay? Most of the time, theoretically, all calls would then be routed in through the 911 line system. Theoretically. Okay? I will show you the type of an emergency call, the flow of it, how it's supposed to work. As you can see, the user, which is a VP, a video phone, some type of equipment, would connect to the relay service center. And then it would connect to the VPC, which would be the call center. And then that would then connect to the emergency gateway. And it would connect and then lead to the router, and they would route it out to a 911 emergency line. And then it would come up on the monitor. So that's what the dispatcher would see, and it would be basically my caller information, theoretically. Now, another way, there's a backup. I would have to manually call a call center. And then it would connect to, let's see, a VPC. And I would ask for a telephone number for that PSAP, directly, and most of them would give their administration or non-emergency numbers. Either one, as backup. Hold on, go back for 1 minute. Thank you. So far, I've been testing it. I've been doing a lot of stuff with it, test calls throughout the years. The first time when a VRS provider made the announcement, that I could handle a 911 phone call, they made a big hoopla about all of it. So I thought, well, I'll go ahead and test it out. And I found out, no, it didn't work. And it required me to use 9 different providers. I had to call one, and then it went from there. The average time, the average speed for this call was 1.55 minutes to 4 minutes and 80 seconds. That was the average time. Then the average time to connect to the 911 center was 2 minutes and 53 seconds. Wow, that was a lot of time. So I did 3 test calls. 3 out of 8 test calls, there were a lot of problems. There was disconnection. There was no call back. There was nothing. So as far as that technology, I would have died 8 out of 9 times. And I only basically have 1 life left. Okay, go back. Okay, recently we had a conference and we did a test demonstration on how a test call would work. And what it showed is that one device on one person on our committee tested a call through the relay service. It took 4 minutes to connect to a PSAP. Now this was through an emergency line. When I did the test call, I did a VRS. It took me 5 minutes to connect to 911 to the 911 center. And it was an administration line. It was not the 911 line. And to this day, this is what's going on. Next one. I did another test call. Same thing, same problem that keeps coming up repetitively over and over again. I can go through to a different city. I can be connected to many different places. The administration line, it's not standard. It's not all the same. That is one problem that we seem to be running into. The minutes that we have counts. We want a response immediately. We are counting the seconds at that point. They are important. Every minute and every second does count. Again, there are a lot of different issues that we are dealing with. We are hoping that we can move forward with the next generation 911, and we can provide direct access for the people who need to use the TTY, the video phone, texting, cell phones, different devices that may be used for communication. Also, it would benefit a lot of the hearing people as well to be able to communicate with the dispatch without using their voice, because the situation that they may be in, the environment, domestic violence environment may be the case. There may be a hostage situation. There may be many, many different things out there taking place, and that is very important. Again, the federal requirement is that we are required to update our database to make sure that our information is ongoing, it's up to date and current. But again, some information may not have been kept up. Maybe I may have done it a year ago, but that may be old information. So, my building, I moved, there's different places, so there's a lot of things that are going on, a lot of things evolving with technology. Okay. And that concludes my presentation. And I do hope that we can move forward from here and we can do the texting and the paging and work with that. because there is a lot of technology available out there, we need to take advantage of that opportunity and use that technology and move forward from here and provide direct access, especially for those of us who need it. Thank you.
I am the medical director for the city of San Diego. I'm also an emergency physician for the last 30 years at UCSD, and I'm president of the AHA here in San Diego. So I'm going to speak kind of on behalf of a little bit of everybody. Okay. The things that I want to talk about, and I'm going to move quickly. Basically, I want to use 3 examples: cardiac arrest, myocardial infarction, and stroke, about what we do today, and then how NextGen could improve the process. Everybody knows that the 911 is to get a single point of contact for emergencies. Primary goals of emergency medical dispatch are to assign resources proportionate to the need and then to assist lay rescuers until help arrives. And secondarily, to preserve the resources for those people that are most in need and to prevent unnecessary lights and sirens responses, remembering that the estimated fatality rate for EMS personnel responding to crashes is twice the national average, 12.7 per 100,000. This is San Diego Fire Communications Center. The upper right shows that we're an accredited center by the National Academies of Emergency Medical Dispatch, and there's our floor of our Fire Communications Center. We actually are a secondary response center. The PSAPs in the community include San Diego PD, Chula Vista PD, San Diego Sheriff, and the Highway Patrol that are all funneling information to us. That's obviously relevant when it comes to NextGen 911, because if they can't do it, we can't do it. We use a medical priority dispatch system. We have a TriTech CAD, and we've had that since '97. And I'm sure you guys must remember that we're trying to sort calls out into 5 different categories: Alpha, Bravo, Charlie, Delta, and Echo, each of which by the card systems connote a certain kind of urgency. We independently analyze every single call type and uniquely identify what we want to assign on those resources. Next slide. In San Diego, we have 4 responses, but one is just a special event response, which is level 22, which is only used for things going down to Petco Park and stuff like that. We try to put a ALS first responder and an ALS ambulance lights and sirens on our level 1 calls. Level 3 calls are the ones that basically get an ambulance, no lights and sirens, and level 4 get a BLS ambulance in 30 minutes. Those are considered the lowest risk. And the way that parses out is that in the 4th quarter of 2010, you can see that 82% of the calls were level 1. Level 2 was almost negligible, 27 calls, but 10% got level 3 and 8% of the calls were level 4. So we try to prioritize our call types to save resources. The challenges to current enhanced 911, there's a lack of a connection in our system between the PSAP and the secondary. There are delays in call processing that occur. When I say link, I don't have any idea when the cardiac arrest call comes into the police department because we don't have that tied in to our secondary response. I don't know when the call really arrived at the PSAP. Data accuracy naturally is horrible. Depending on first, second, third, or fourth party calls, it's either I have chest pain, my husband has chest pain, there's some guy with chest pain, or there's some guy on the way by ambulance to the border who we think might have chest pain. And so all of that is basically, you know, the garbage in, garbage out concept. Staff training and CQI are naturally always challenges in any kind of an environment like this. We use a system that I created about 15 or 25 years ago that actually rank orders the calls based on the medic. One of the problems we don't have today is, or we have today, is we don't have any outcome. So the medics instead create a transport code which reflects acuity. And I pulled out 10, which are the acute status calls. We use that as a feedback loop to try to identify whether our calls are actually being dispatched appropriately. It's a scorecard, if you will. And this basically shows that line traveling up are the code 10 transports. Those are the acute status calls going from the medical priority dispatch call A, B, C, D, E, and you can see that even the lowest priority calls in the medical priority system have a 1.4% chance of actually having a bad acute status call, and they rise up to the E-level echo call about 17% of the time. So it's imprecise, but there is some trend. So this is how you run a 911 system. You have to be more sensitive than specific in order to make sure you get all the emergencies. Using cardiac arrest as an example, everybody knows by now, hopefully, that there's a link in the chain here in order to get to somebody quickly. And so if we look at that point, next please, there's this clock that's ticking. We know that too. I mean, from the collapse to the recognition to when you actually get somebody get a phone and start calling 911, what kind of phone is it, landline versus cell, to get to the PSAP, to get through the PSAP and the congestion that may be there, to the secondary, to finally maybe just giving instructions for CPR for the first time by a dispatcher, to finally having personnel at the scene, and finally next at the patient, and finally delivering a shock, and then finally giving drugs and getting to the hospital. That's the clock that defines cardiac arrest survival. And anything in there that you can't measure, you've got a problem with. This is the survival curve. You could say it's decaying at roughly 10% a minute. Without any treatment, most people will be dead within 8 minutes. Next. If you add CPR, you can stretch that out a little bit more. And if you do yet another, next, if you add CPR and then get a defibrillator there, then you change the survival curve. So these are the critical elements that we're trying to impact. We have delays in lay people recognizing an arrest. We have delays in call routing, as I mentioned, from the PSAP to the secondary. If a call gets stuck in the highway patrol for 3 minutes, the patient's 30% less likely to survive because 3 minutes just went by. Landline versus cell, therefore, becomes an issue. Where did the cell phone go? Where does it go? The delays in the queue, and then, like I said, the lack of CAD interconnectivity interferes. Next. We also have delays in dispatchers recognizing cardiac arrest today. In fact, 50% are unrecognized, and there are new tools that we're using to try to improve our ability of the dispatcher to recognize agonal breathing, which is the cardinal thing that identifies somebody as in arrest and needing CPR. There are delays in initiation of telephone CPR because, again, dispatchers still have some, they have to know how to do this, how to get somebody off a bed, get them on the ground, and begin CPR now. Not 2 minutes from now, but now, right now. Inability to monitor the quality of the CPR is obvious. We don't have any way to look through the phone today to help guide that person do it, and inability to supervise the use of an AED would be a wonderful thing to do in a NextGen 911 system. Now, this is a scattergram almost of all the ways that cardiac arrests come in to a dispatch center. They come in as cardiac arrest, but they come in as unconscious and breathing and chest pain and seizures and falls and sick people. So trying to find out what's going on here is very difficult, yet NextGen might be able to do that through a handheld phone with a camera that could show somebody what's really going on. Next. Secondarily, there is definite evidence that if you do telephone CPR, that you can improve survival. So these are 3 different studies, international studies, that showed without telephone CPR or with telephone CPR, survivals improve. Next. Finally, training is a big deal. These studies all show that if you train dispatchers in how to recognize and see people, patients do better. Next. And then finally, the proof of the pudding is if you compare major cities in the United States all doing cardiac arrest, the survival rates are tremendously different. Now, how can that possibly be? And I think it's because of delays in accessing the 911 call and getting it to the PSAP. If you have and secondary answering point, if you have a process where the calls are routing all around and getting hung up in a queue and it takes 2 minutes longer in one community than another one, your survival rates will be 20% worse. Next. Medical alert alarms, just another example of we don't know what's going on. That would be a wonderful thing. I mean, we had 996 of these last year. We ended up sending fire engines out, and then they found out there was nothing the matter. If that technology had the ability to we could query it, we'd be in a better position maybe to save almost 1,000 responses. So that's just, I'm going to future think a little bit in technology next. Okay. Don't read this. It just shows you that there are 4 studies in the literature already that show that if you use interactive voice and video cell phone technology in mannequin studies, these are just mannequins, that if the dispatcher can see the person doing CPR and they can feed back with a live interface, they'll do better CPR. So the technology of a 911 system in the future should be enabled to see what's going on at the scene and to direct people to do chest compressions better and to be able to use a defibrillator more accurately. It's already been shown scientifically in mannequins. Now we just have to use that technology. And then obviously all these other things, broadband telephone CPR with instructions that we could send to the person who has a cell phone to help them go through, and then iPhone applications which would identify where's the closest AED immediately. Next. And these techniques are actually being used in some communities already, but this idea of geolocation of the defibrillator is a very important point that we really want to capture and harness. As the new devices have geolocation capabilities, we want CADs to be able to say, there they are, go get it, it's 100 yards down on the left. Next. We can geo-map cardiac arrest now. This is CAD data that I used, one of my fellows, Dr. John Serra. This is all the cardiac arrests in the city of San Diego. Next. And we can even geolocate where problem areas arise, where people are not getting CPR done proportionate to the number of cardiac arrests. So using targeted public health strategies. This is all possible with CAD data now. Next. What's coming is pre-hospital ultrasonography and transmission of data. It was used in the military initially, but the idea of being able to have a paramedic who could have a little ultrasound device and show cardiac standstill, the patient would be dead. You'd be no need to transport a patient to the hospital if they were absolutely dead. And this technology is coming quickly. Next. We have resuscitation centers in San Diego. We want to move people there, and the science is moving very quickly in terms of the data that will come out of the field that needs to get pushed to the hospitals, maybe with CAD data. Next. Myocardial infarction being another example. This is a 12-lead EKG. We're now pushing this information and trying to link it with patient information at hospitals so that the patients on arrival will have all the information and the specialists that they need to be able to deal with these cardiovascular problems. Next. This is the clock, the 90-minute, what we call E2B time, from emergency first responder or whoever touches that patient first, and it could be a paramedic, to arrival and get a balloon inflated in that guy's heart to open it up to save his life. It's 90 minutes is the clock. In the near future, that clock is going to, next slide, is going to click back, and it's going to be dispatch. So communities are going to own the entire process time from dispatch to 90 minutes in the balloon. That will be the new metric of the American College of Cardiology within a couple of years. Dispatch has got to own that piece of the puzzle. Next. Challenges. Like I saw, there are a lot of challenges. Half the time people just go by car rather than call 911. We have a really hard time figuring out what's going on today. You know, dispatchers, are you having difficulty breathing? Are you having chest pain? Are you clammy? Are you changing color? What's going on? You can't tell without looking at a patient. Next slide. So we scattergram these things, and I try to develop code 10, 20, 30, 40, 50 profiles for the dispatch cards in our system so that I can have some idea of what the likelihood is, the predictive accuracy of the cards. They're not that good. Next. Devices like this exist. We have 24 patients in San Diego now with left ventricular assist devices. This device is very sophisticated. Let me show you a patient who's wearing one right now. Dick Cheney, okay? Just to give you an example, these aren't rare things anymore. We've got almost 24 of these in San Diego, and the ability to use that type of life-saving stuff in the community is only going to get bigger. Okay. Finally, stroke. We have a hard time recognizing it. We have very poor accuracy in 911 in identifying this, and even worse for the medics and the dispatchers to try to figure out what the heck is really going on here. And this is another time-critical disease we really need to be accurate on. Next. The predictive accuracy of dispatch today, this was published in San Diego by one of my colleagues, Dr. Ramanujam. The emergency medical dispatch had, against true strokes, was 83% sensitive and only 42% specific. So the protocols themselves are not very good. Next. Here's a study that was done by another UCSD colleague of mine that definitively showed for the first time that telemedicine is superior to telephones. This study was published 3 years ago in The Lancet by Dr. Meyer, and it showed that experts using telemedicine were more accurate in identifying the correct treatment than just asking questions over the phone. So this is the future, is telemedicine. Next. Things like transcranial Doppler, the transmission of these kinds of data literally are coming to be able to image blood vessels in the brain and send that information downstream to the hospital. Last two slides. The base station online control system, I think, needs to go away at some point. We have 7 hospitals all trying to direct traffic here now with radios. The future? Next. Telemedicine. Next. This is the San Diego model. We have a $15 million grant from the federal government, the White House, called a Beacon Grant, to demonstrate the power of the electronic information exchange. So San Diego's model, as you see, is it's a hub on the National Health Information Network, the cloud of the future, where the Obama administration is taking healthcare. And we will tie into that, and we will search all over the world for information about patients. CAD is linked to that. Hospitals, EMS, county, everybody will be linked onto that hub in the future. Next. And so this is what it looks like, really, with EMS and public health and hospitals all sharing data across these platforms, wirelessly going into the network and finding information, pulling whatever is appropriate, so that when my medic gets to the scene from CAD, they can find out if there's a do not resuscitate order, or what medicines that patient is on. That's all coming, and within 3 years, UCSD and San Diego will have built one of the first prototypes in the nation to show how this is going to work. Last. So regional medical control, and here's my joke. There's Dr. House sitting there at his, in the Fire Communications Center giving advice to this patient, but I truly think that that's what's happening. I think you're going to see in the next 5 years, like in New York City already, medical direction for paramedics is provided by doctors in Brooklyn, 24/7. They have physicians in consoles giving advice to medics. I think the future is that as healthcare moves, that pie chart of all those people that are not sick, there'll be much more intelligent systems in place that will allow you to be able to direct those people to more cost-effective strategies. So that's, there's emergency and there's non-emergency in the 911 system. Only 8% are really emergent. All the rest have got something else that we could do with them, potentially much more cost-effectively. Last slide. There's my email address. You can call me for advice. Thank you very much.
If you take a look at the pictures that I have here, the police car, the fire truck, the communication center, which was the communication center, this thing is very sensitive. We believe that's Los Angeles circa late 1960s. 911 as we know it today became a universal number in 1968. The first universal emergency services call for help number in the United States in 1968. The first 911 call, a basic 911 call, pick up the phone, dial 911, goes directly to some place to answer it that can provide you police, fire, EMS, whatever it might happen to be, was in Haleyville, Alabama in February of 1968. Before that, you picked up the phone, you dialed the operator, you told the operator what it was that you needed. Joy took some of those calls as a very, very, very young lady, a mere child, and she was actually given training on how to take those calls as a telephone company operator. We then went to basic 911. And basic 911 was, we send it someplace, we don't have any information with it, we don't have name, we don't have address, we don't have telephone number, but at least we got the call somewhere. And I'll go the right way. And then we went from basic 911 to enhanced 911. And you'll be interested to know that in 1974, Alameda County, California, was given one of the first federal grants to develop a 911 program. They were given $150,000 by the Law Enforcement Assistance Administration to develop enhanced 911. They went live with that 3 years later in 1977. They actually went live on July 9th, 1977, which was my birthday. Now, supposedly, the first enhanced 911 call was made on September 18, 1976. That was the day I got married. And my good friends in Chicago say that it was my wife calling, asking, never mind. What is Next Generation 911? And I think it was said very well, it's not all about the technology. Next Generation 911 is about saving lives. It's about using those things that are out there available to us today to be able to deliver services to the public that you serve. Citizens' expectations. Recently, in June, July of this year, a sergeant in the public safety from the state of Delaware did a survey of 8 high schools. In those high schools, they were in Illinois, Pennsylvania, and Texas. 93% of the high school students said they used a cell phone, excuse me. 6% said a PDA, 1% said a landline. They were begging their mom and dads on hands and knees to get their cell phone, but they were still using the landline, and none were using any other type of device. But what's really critical to that is it dependent on the type of event that transpired, how the student would use the phone to contact emergency services. If it were a car accident, 93% would use voice, only 2% text. A house fire, 85% voice, 11% text. But an intruder with a gun, 87% would use text and only 6% would use voice. And that was no more obvious than it was at Virginia Tech. The young men and women at Virginia Tech could text their parents to say goodbye, but they couldn't text 911 for help. That, ladies and gentlemen, is something that we have to solve, and solve quickly. These look like normal high school students, but guess what? They're not. They're part of the deaf, hearing impaired, and speech impaired community. They don't use the iPhone, the smartphone, the texting as a fun thing to do. It is their tool. It is their method of communicating, their method of reaching out for help. And today, we can't help them. Next generation 911 technology. We talked about the fact that the IP backbone is there today. It exists. It is being used every day across many applications that are just as mission critical, or perhaps not just as, but are mission critical applications on the same par with 911. They're used for the financial community, they're used by the Department of Defense, they're used by the medical community. IP is a proven technology that is being used every day. 911 is an application, a very specific application, a very critical application that is being developed to reside on that backbone. The IP backbone is in place today. When we talk about, and Ryan mentioned it, all of the folks out there that are chomping at the bit to develop new applications, we really have opened the door for 911 where it now becomes the iPhone apps for public safety. People that have never, really smart people that have never thought about developing anything for 911 now see that they can go out and develop things that can reside on that platform and develop services to public safety. It's our responsibility as industry, it's your responsibility as public safety to make certain that we want all of those, that we have a way to certificate those to make certain that they are things that we want to have come into public safety. But there are going to be so many of them, it's unbelievable. Have any of you seen, about 3 weeks ago, Bones? I love Bones. Bones did an episode on ShotSpotter, where ShotSpotter, an application that uses microphones to detect shots fired, was used to help solve a crime. ShotSpotter can be integrated into the public safety system, into the 911 system, where we can deliver that information with a call. So that depending on what you know about that call, you can let a first responder know before they go to a call that there have been shots fired within so many meters, within so many minutes. Protect the first responder. One of the most important jobs that we have. The future of next generation, and Joy said, her first slide said what my last slide was going to say, and that is any device, anytime, anywhere can request help. And we, as public safety, will have the ability to determine what help is needed and get the appropriate help to the appropriate place at the appropriate time. Are there challenges and opportunities? Absolutely. We've talked about all of them here. We've talked about funding. We've talked about transition strategy. But do we need to overcome them? Absolutely. Is it the time? Yes, it is. Are we going to deliver something out the door that's what it's going to be 10 years from now? No way. As Ryan said, we don't know that next generation 911 will ever fully be deployed. We're going to continue to add, continue to do things. Are we going to do them in standards-based? Absolutely. NENA, the National Emergency Number Association, is working with Addis and ESIF, the Emergency Services Interconnect Forum, to ensure that we have standards that we deliver these applications in a manner that can be received. iPhone apps. When you build an iPhone app, you build it to a standard so it can get out to that device. When you build a 911 app, you're going to build it to a standard so it can get to that public safety answering point, so it can get out to that first responder. We've actually had talks with science and technology. I heard a P25 comment earlier, science and technology about SafeCom. And how do we get next generation 911 involved with SafeCom so that we can ensure we have an IP backbone that will take calls from the person who hits the button to the person who's going to answer the call? Yes, we are. Thank you very much.
Good afternoon. I just want you to think back to the last time you heard one of those radio commercials from OnStar where there is a crash, everything is black, you don't know where you are, and then all of a sudden you hear the voice of an angel saying, "This is OnStar, how can I help you?" The technology behind OnStar, which we call automatic crash response, has actually been around for nearly 15 years. It started off initially with just a voice activated by a crash that deployed the airbags, and it has moved much further. So what I'd like to do in the few minutes here is give you an overview of what telematics in general, and there are two primary players, OnStar and ATX, on how we go to business. So, should I just click here? Excellent, thank you very much. Whoop. This is very sensitive. Okay, so what I wanted to do is give you a few stats. This is just from OnStar's perspective. Just for perspective too, we interact with the public, our customers, every second of every day, 24/7, 365. In general, it's also helpful to understand that in terms of automatic crash response, that's where the car is hit. The car actually calls OnStar to tell us that the vehicle has been a crash, because you may not be able to find your cell phone in the car, or you may not even be able to think about what to do in a crash. 24,000 times on average annually. In the state of California, nearly 2,000 times. Other emergency services, there's actually a red button also that you can press in the vehicle for emergency services. That happens 120,000 times in the course of a year. You're having a heart attack, or somebody in your car is, and you need to get help. In addition, one of the things we're very proud of is that about 75,000 times a year, somebody presses the red button and say, "I have spotted a wildfire, I'm in California, and I have no idea where I am." And because of the precise GPS location we have exactly from where the key press was done, we can provide that information directly to 911 to be able to help them send the right services. As you can see, there are a number of other things we do, and in general, just for perspective, we have 5.8 million customers in the US and Canada right now. These are paying customers, as well as about 365,000 active subscribers in California. Oops. As I mentioned before, the two primary providers of telematics in the United States and Canada are OnStar and ATX. As you can see, OnStar has it through GM products, which would be Chevrolet, Cadillac, Buick, and GMC. We also provide it for Saab. One thing that we've just announced within the last couple of weeks is that we'll be able to provide an OnStar mirror that you can buy at a retail outlet and put on any vehicle, so that any vehicle in America essentially could have OnStar. Put it in the Camry, put it in the Ford. In addition, ATX provides services for a number of other car companies, including Toyota, the Lexus brand as well. Hyundai was just announced, and they'll be starting to provide services later this year, and BMW. And I think it's very important to note that the reason why OnStar and ATX are actually sharing this podium through the course of these 6 discussions is because we believe that our mission is the same when we interface with the first responder community. We will go exactly the same way to 911. We work on it together. We sponsor the same events. We are side by side sitting with Nina and Abco, the 911 representatives, every time we go out. It is so critical that you don't have to try to figure out multiple ways of going to business. We do it one way, and we work very closely together. And Gary Wallace will be presenting at some of the other forums. In terms of some of ATX's numbers, you can see that they have about 1.3 million subscribers in US and Canada and doing the similar kinds of things that OnStar does. So let's take a look at what happens. Here, as I described initially, there's a car crash. What happens next? Data is immediately sent to what we call a TSP, that's a telematic service provider, that's OnStar, through the cellular network that's already established. So you basically have a cell phone in the vehicle that makes the call out to our call center, not to the PSAP, but to our call center, and we know the exact location of where this happened is because of the GPS technology that's in the vehicle. So the person receives that call. We have voice communication, that's the angel I was referring to earlier, and the data from the crash is actually sent to our call center. So that's primary direction of force, multiple impacts, the actual delta velocity of the crash, if the seat belts on the passenger driver were engaged, and potentially rollover, a whole bunch of pieces of data. We've been able to do this for at least 7 years already. So we provide that information, but as you notice in this, we then make an immediate call to Public Safety Answering Point, a PSAP, or the 911 office. However, it's only voice, except for potentially if it's stage 2, that they'll be able to have both the GPS location, lat long, as well as a callback telephone number for OnStar, as well as a case number. But in some places in America, it's only voice. But none of the additional pieces of data that we already have about that would be very helpful possibly in terms of how to dispense the right type of services. So the PSAP then dispatches the appropriate services, whether it's EMS, fire, maybe it's a helicopter, or the law enforcement community. That's the current situation. One of the things that the Centers for Disease Control, working with NHTSA, National Highway Transportation Safety Agency, as well as the leading researchers in trauma in the United States have found, and they published in this journal, is that if we can use all of this additional data that we can glean from the car from a crash, we are going to be able to have a probability of predicting the likelihood of a severe injury. We can decrease the amount of time it takes to get the right first responders to the scene. We can assist in the field triage as well as transport decisions. In other words, if you know that because of the way that crash happened, it was from the left side with a delta velocity of 60, and there were multiple impacts, and they weren't wearing their seatbelt, we know in 1 second that that person has to go to trauma hospital immediately because the severity of their injuries, as defined by the Centers for Disease Control, will most probably have an ISS, or injury severity score, of greater than 15. We can be able to help them know that. It's not just a regular call, we have all of this information. In the future, you'll have the vehicle, you'll have that same, using same cell network, the same GPS information, the same call still comes into our call center, both voice and data. But what changes here is that all of this crash data is then transmitted as well via data link to the PSAP. So crash direction, crash speed, as I mentioned before, seatbelt uses multiple impacts and rollover. And we can assign a prediction of the probability of severe injury. And the way we have been talking about it amongst ATX and OnStar is we'll say there's a high probability of a severe injury. A whole bunch of education will have to take place with the first responder community as well as with fire and police to make certain everybody knows what that means. But we will be working on test cases of actually showing in deployments in various places in America about how that has changed the decision making. That report that I just mentioned from the CDC is also based upon research done recently at Johns Hopkins, which said that if in a severe crash, the person in the crash is sent to a level 1 trauma center if they have a severe injury versus going to the community hospital and then being transported to the level 1 trauma center, there's a 25% higher probability that they will live. In medical science, there is nothing that will make as significant of a difference in terms of final outcomes, life or death, than they believe using this data to determine how to dispatch the right resources to the right hospital in the right time. As I mentioned before, voice and data will go between the PSAP as well as injury severity prediction as well as the data so that the right level of service can be dispatched and get to the person who is in a crash so that they can get help. We see this only as saving people's lives, and I'm very proud to be part of this industry and this technology, and if since I haven't seen it already, I want to make certain it's clear. OnStar and ATX do not have a business at all if it weren't for our interactions with the first responder community. We work very hard to provide training and insight to them about our services, and we glean a great deal from them in terms of what are the needs for them. And so we've developed many services based upon that, including this service right here.
Thank you. I just want to thank the participants in the panel for allowing me to speak today. I'm going to be very focused on my presentation, and essentially what I'm going to talk about is statewide data. A lot of the technology that we've heard about today regarding NextGen and the opportunity and exciting things in the future for NextGen relate to data, new types of data, and how that data will be acquired and then transferred to the PSAPs. And the focus of my presentation and my company is how we can use this data to supply agencies such as Ryan's or other CHP, for example, or other regionalized emergency response organizations, how to use the data. So we're going to go through a quick history of kind of where we are now, kind of the state of the art, and where we think it's going. Talk a little bit about how we can use the data to improve public health and safety. Next slide, please. So currently in the state of California, for many years, there's been several systems that AT&T and Verizon have used to collect data to provide for the state, those being Furnace and CarsNet. And recently, an initiative was undertaken to consolidate the statewide data gathering into a new system that is managed by Verizon and Direct Technologies, and it's called ECATS. And the primary function historically has been for this data to be used by the 911 office to monitor, analyze the trunking, call times, ring times, et cetera, and to be able to have the appropriate usage of the state 911 surcharge funds. So it helps the Sacramento folks figure out how to allocate resources. Next slide, please. And so examples of the types of data, you'll see the black line up there. We've redacted some information, but essentially this is stuff that we all recognize as, this is a standard call record, which is kind of gibberish, but this is an example of raw data that has certain regulatory requirements for the PSAPs to keep. It's used for call analysis, as I mentioned, regulatory compliance. Sometimes it's used for a forensic investigation. If you have to go back and look at a call that went right or went wrong, then how can you use the information provided here to kind of reassemble a call? Next slide, please. And this is an example of call duration. So again, this is from our Furnace system, but essentially you have histograms and you have tables that show durations, for example, in this slide. Next slide, please. This is calls per hour graph. The graph you see up there, the colorful graph, represents, say, 24 hours in a day, and it's I've been in this business for about 15 years, and that thing's never changed. So essentially, the peak calls happen between 3 or 4 in the afternoon, and that's a very standard graph that you'll see. And I realize that the people in the audience, you can't see the detail we're looking at here, but it just, you know, this is an example of calls per hour that would be used by the state to monitor network usage, trunking, perhaps if the PSAP was requesting additional call taking positions, et cetera. This is how it would be used. And also want to emphasize that the PSAPs themselves have very sophisticated CPE that's provided by numerous vendors that they give them, you know, very powerful data as well. So again, I'm focusing on the state's access to data. Next slide, please. Just a couple more. This is the left-hand side shows a little pie chart there of the call types. There's no way you can see that, but it's wireless phase 2, wireless phase 1, landline, etc. And on the right-hand side, I think it's the ring time and ring time groups so that you can monitor if a PSAP is in compliance with answering times or ring times. Next slide, please. So just a quick history, and this is, I'm not an engineer, so please, if the questions asked by the panel, I hope we're not going to get too technical. But this is pre-1997. Essentially, what happened was we worked with AT&T. There's a serial port interface in the back of the phone controllers that there was this, through a Y cable, the data was collected. Next slide. And it went through our systems where we took the raw data and we parsed it and created information systems for the state. Next slide. It was called Furnace. In the last couple of years, we've also used the same data to provide a product for the state to more efficiently route wireless calls. The program is called RED, Routing on Empirical Data, and we were able to use this basic level of data. It was the phase 2 wireless data, looking at the X, Y, and interpreting through a system of analysis how to more appropriately route a wireless 911 call, which, by the way, makes up about 72% of all calls, all 911 calls in California. Next slide. So what we want to talk about here is how when a NextGen system is implemented, how will this be used to save lives, to be more predictive? How can the state or any large agency use data, this very large amounts of data, to positively impact outcomes for human health and safety? Next slide. I think we're out of order here a little bit, but this it's okay, Paul, but essentially this is showing the new ECATS implementation, so we can skip past this, but this is the state consolidated network. And then lastly, there's a current IP interface on much of the controller equipment in the state of California that allows us to gather some enhanced data now so that we can do some of the fancy things that I'm going to show you next. So let's go here. So we've been working with Ryan's office for about 1.5 years now to come up with new ways of displaying large amounts of data. And so what we're looking at here, for example, is call volumes coming through. This is a static shot of a live system that's using real-time data from the Furnace system, for example, where we can take the raw data that's scrolling down the right-hand side of the screen, and we can look at where the most activity for 911 calls are in the state of California. And in this example, you'll see a bunch of colors, dots, and circles, and what that represents is the amount of call volume per individual agency. So at a quick glance at this particular snapshot, we can see that the CHP in LA, the LA City PD, and I think it's the Merced in the Northern California, and CHP Sacramento maybe. I can't see, my eyes aren't working that well. We can see that in the last hour there were 266 calls, for example, and the amount of traffic, and that 45 PSAPs were active. You can also see, and again, this is optimized for a 55-inch high-definition monitor, but you would be able to see, if you notice on the second column, there's a red indicator there which shows that that particular agency's call volumes are out of the norm. So at a quick glance, you can say, hey, from a perspective of a state office, for example, that there's something interesting going on. Next slide. Here's another view of how would you look at the entire state's 911 data from a command and control situational awareness perspective. Again, the top 55 PSAPs are listed. Anywhere you see red, it means you're out of the norm. And again, I think these slides will be published so that people can actually see them if they choose to really look at the data. But this is actual data, and you can see where, for example, in the red, and that little white line in the gray bar shows what the average is, and the gray bar itself shows at the current run rate what we would anticipate the number of calls would be for that day. Next slide, please. This is kind of an interesting slide. This shows CAD data from New Hampshire. Actually, we've mocked it up to show what it might look like in California. But one of the interesting things that we've been looking at for quite some time is why people call 911. And those of us in the industry know that quite often it's not for emergency services. So what we want to do is be able to provide tools such as this to allow public safety officials to understand more precisely why people are calling and how to utilize resources to minimize non-emergency calls, educate the public, for example, and deploy resources more appropriately. And again, this is mocked up for California, but this is actually how it breaks out in the state of New Hampshire. Next slide, please. One of the things that we're very excited about is a calculator tool that we've developed for here in California and also in Massachusetts. I'll show you another view. But part of what we were able to do is not necessarily a next-gen, it's actually a current-gen technology, but it's the type of thing that will be more enhanced in the future, is to start quantifying how shaving seconds off of a 911 call, or more appropriately routing a 911 call, can save lives. And in this case, we worked with Dr. Angelo Salvucci, who is a colleague and a friend of Dr. Dunford, on a specific disease state, which was sudden cardiac arrest. And it's intimidating talking in front of the doctor, but my understanding is that it's a unique disease state in that it's fairly well documented, the rate of incident per 100,000 individuals. It's also fairly well documented that every minute that you shave off the response time, you can increase the likelihood of survivability by approximately 10%. So using that mathematics, you can say, make assumptions about, well, if I shave off 30 seconds or a minute, how many more lives can we save? And that's what we've done here, and this tool is now active for the state of California. And as part of what we've done in the RED system, we've looked at calls that were traditionally routed to the CHP and said, hey, perhaps those calls are more appropriately routed to a local agency, but the only way to know that is to really do an in-depth analysis, do a cutover, and then do a post-analysis, and so far the results have been quite successful. Next slide, please. This is a version for Massachusetts. There's some nuances. In Massachusetts, they have 275 PSAPs, for example, and 100% of the wireless calls go through 3 state police call centers. So there's huge bottlenecks, and we're doing the analysis now for Massachusetts and working with the local emergency medical directors in Boston to hopefully show some really interesting results. Next slide, please. Lastly, I just want to finish up real quickly. This has been touched on before. In current environment, we're using maps like this, which has been where the wireless service providers erect towers and they worked with companies like TCS and Entrado who develop maps, and these maps are used by the local agencies to determine the appropriate routing of the call. And next slide. This has been touched on before, but in the future, we're going to have much richer data where we'll look at different layers. This is an example of how, on the previously mentioned RED project, we developed we just use commercially available base data, but then we have a collaborative system that we built that allows different jurisdictions to agree upon the jurisdictional boundaries, which are not necessarily the same boundaries as civic boundaries, for example. And then there's an analysis that's done, and then we overlay beat maps and do things like anomaly analysis and other things. So that concludes my presentation.
Good afternoon, everybody. Thanks to the panel for inviting me here to speak. Again, my name is Ron Stein. It's a relatively convenient opportunity for me to speak to you here, given that I live down in San Jose in Silicon Valley and work just up the road in Mountain View, where it's regrettable that Lisa is now predicting is going to be the epicenter of the next major earthquake. I hope her prediction is, in fact, incorrect. It also says on the agenda that I'm going to talk about ShotSpotter. I've been with ShotSpotter about 4 years. What I'm going to talk about is sensors and surveillance systems, benefits that they bring to public safety and emergency response, and the importance that they will play in terms of interfacing and integrating with the next generation technologies that Mark and John touched on earlier, and somewhat similar to Gary's conversation as well. Not quite a node on that network, but our system should be and could be a provider of data into the next generation 911 feeds in compliance with the EISI network capabilities. ShotSpotter has been around since 1995 and has been doing next generation types of alerting since that period of time. Alerts that we deliver, our system delivers to PSAPs and dispatch centers are multimedia. They have an aerial image of a map. They have audio files, so they're multimedia and they're digital in nature. And those connections have been dedicated connections. We very much look forward to the day when those dedicated connections can go away and we can use something like next generation 911 infrastructure. Given how long we've been doing this, we know a lot about the benefits of sensor and surveillance-based systems, and over the next few minutes here, I hope to convince you of that. We also know a fair amount about the critical success factors of non-voice, non-human initiated requests for assistance, which is what come from alarm and alert and sensor-based systems, as opposed to some of the other things that was discussed here today, such as texting from cell phones and those sorts of things. We also know a fair amount about how workflow and efficiency are impacted. Unfortunately, these latter two topics are not something that I'm going to have the time to drill down into as we discuss here today. As I mentioned, our system has been doing next generation types of alerts now since 1995. We've recently completed an integration with Entrado's A911 next generation system. We'll be doing the same with Plant CML and every other system out there. We also want to take a moment to greatly applaud the state of California in their next generation 911 roadmap for calling out the importance for sensor and surveillance systems. Similarly, for the federal government and the FCC for commenting on sensor and surveillance systems, and in fact, acoustic gunfire detection systems in the National Broadband Plan, as well as the recently released notice of inquiry, which people should have responded to by today. There's a variety of surveillance systems out there. Most of you are probably familiar with the most common ones, which are video surveillance systems. There are ones, so videos are visual. There's also acoustic surveillance systems, perimeter intrusion, a variety of surveillance systems that basically accomplish something that humans contacting 911 can't. Surveillance systems are more consistent, more reliable, and they can tell emergency services and public safety more about what's going on, and I'll drill down into this in just a moment. Surveillance systems rely on sensors. There's numerous sensor types. So a video surveillance system uses cameras as their sensor types. There's vibration sensors, people perhaps approaching or trying to jump a fence where they shouldn't be. Again, part of perimeter detection, smoke, fire, temperature sensors. I think it was Gary in his or somebody presented earlier about personal medical devices. They can also reach out and create a request for assistance now. So there's a variety of sensors out there, and how they play into next generation 911 as I alluded to, they can automatically generate an unbiased and very consistent request for assistance. They can quickly identify a crime either that just occurred or that's in progress, a violent attack, a terrorist attack perhaps, an accident that occurred. Gary spent a lot of time describing that, as well as other sorts of emergencies. So these non-voice, non-human initiated requests for assistance from sensor surveillance systems are very important to emergency services and public safety. Slide didn't build the way I intended. So we'll go back. What sensors and surveillance systems can do is they can exactly and precisely communicate to a PSAP exactly what is occurring or had just occurred. They can enable them to provide a faster, more appropriate response. In other words, the responders know exactly where they're going and they can equip themselves correctly. They can go to an exact location as perhaps contrasted against a fuzzy location, somebody calling in and saying, I think something happened somewhere nearby. And it's very unbiased. You're not dealing in these situations with somebody over the phone who's frantic, who was just involved in an accident, who heard something loud, perhaps such as gunfire or a gunfight, and can't articulate, or it takes the call taker a little while to settle them down before they can get the information. These alerts come in, they're very specific, very detailed, very quick. As I mentioned, sensor and surveillance systems can tell emergency responders as well as local leaders more about what's going on so they can do their resource planning more appropriately. That all contributes, again, to greater public safety. So, quick set of quizzes. Which is better? Somebody calling in saying, I smell smoke, or a sensor surveillance system saying, indicating to a PSAP exactly where there's a fire, what floor if it's a multi-story building, and oh, by the way, there's incendiaries on the 5th floor. This goes along to some of the things a few people have mentioned here today where they talked about additional data coming in. I refer to that as data correlation. So here's an opportunity for the next generation 911 system and network. As that alert passes through, a computer can quickly look up 117 Oak Avenue and recognize that it's a fire alarm and therefore correlate additional information that's relevant and pertinent to the responders in terms of how they approach that scene and deal with it. In this case, incendiaries on the 5th floor. So data correlation is very important with these types of alerts. That can happen much faster when the alerts are digital in nature. The computers can quickly read that, interpret that, provide correlated information. I think it was the lady on the end who said, more is definitely better. Tell us more about what's going on. There's an opportunity to do that. Gary spent a lot of time talking about this, so I won't delve into this much further, but if everybody's injured in a multi-impact collision, is it better to know that a sensor system picked up a multi-impact collision versus a single impact collision, so that, again, the appropriate resources can be dispatched to deal with that situation. Next in the series of which is better, somebody having a heart attack or a stroke. Personal medical device could reach out and tell you exactly where this person is. They're not making a phone call, they can't even text because they're having a stroke. These are the kinds of values and benefits that sensors and surveillance systems can provide to emergency responders and public safety. Something a little bit closer to what we do, not only here in San Francisco and the Bay Area and around the country and the world, is detect and communicate gunfire, which most places is illegal. And one of the things that we find out after our systems are deployed and our customers can benchmark the capabilities is that people call in around 20% or as low as 20% of the time when there's gunfire in the urban communities. It means 80% of the time nobody's dialing the phone. We also tend to find out when they do decide to dial the phone, it's generally 2.5 to 4 minutes before they make the decision. What was that? Should I call? Did somebody else call? Last time I called, nobody showed up. What should we do? It's 2.5 to 4 minutes before they have that debate and they place that call. So emergency responders cannot act until somebody places that call, absent having sensors and surveillance systems out there in the marketplace. The situation gets even more complex. Imagine a gunfight occurring up there in the northwest corner of that map, and you have several callers. I'm sure this has never happened in Lisa's or your center over there. You have 3 different callers all calling in and saying, I heard gunfire, and each of the 3 callers giving a different location. Officers will respond to that And as you can see by that shaded green circle, they've got a rather large search area that they're going to arrive to several minutes after the fact, hunting essentially for a needle in a haystack. So back to my series of which is better, hunting for a needle in a haystack over several square blocks, or a rich digital multimedia alert that puts a dot on the map and says, something happened here, here's what happened, here's the severity of what happened. In the case of law enforcement, and again, what we do, one of the things that we find is because the location is accurate, because the alert arrives there in seconds versus minutes, responders can respond. That increases agency responsiveness. That increases public confidence in their agencies. And the public generally is then more cooperative for follow-up investigations because now they see a more responsive agency. Why? Because sensors and surveillance systems can tell emergency responders and public safety more details more often about what's going on. In the case of our business, it tends to help those cities and communities enjoy the benefits of reduced gunfire and violent crime. So to wrap it up, sensors and surveillance systems have a number of benefits. They accurately report emergencies, crimes that just occurred, crimes in progress, attacks, directly to PSAPs, and something that I didn't touch on earlier is those alerts can go directly to the responders as well as they're approaching a scene. So this is tremendous value as well. It allows them to arrive more safely. It's much better for responders to know if they're going into a fire where there's possible incendiaries nearby or on site. For law enforcement patrol officers to know whether they're going to a single shooting or a gunfight and things of that nature. All of that can come about by sensors and surveillance systems, which is much more accurate and unbiased than a lot of times when callers call in. And again, it's faster and more appropriate. I mentioned the value of the data. People can plan their resources better. And having said all of that, I'm doing my best to stick to my 10-minute slot and conclude by saying that, again, we applaud the state of California for putting sensors and surveillance into their next generation 911 roadmap. Similar applause for the federal CC with regards to the National Broadband Plan and their notice of inquiry. And when coupled with next generation 911, at least I hope that I've given you a sense that sensors and surveillance systems can help emergency responders, emergency services, and public safety personnel achieve what voluntary callers, who often are not even eyewitnesses to what went on, achieve and enjoy greater benefits for public safety.
Good afternoon. I am John Hunt. I'm with TCS, as you can see from my slide there. I also wear a different hat. I have been with the state of Michigan's 911 committee for the past 24 years as the governor's appointee. And as Jeremy mentioned in his presentation, Michigan is one of the states that is currently involved in their planning process to take a look at how to best implement NextGen 911 on a statewide basis. And so I'm here today to listen to what's going on in California and to try to take some of that information back also. But I will try to keep my comments brief this afternoon in the interest of time and with the goal of trying not to repeat information that we've already heard from the excellent slate of speakers that have already spoken this afternoon. So I'll be going through my slides rather quickly. What I would like to accomplish today is to take a look at the 911 industry. I have been around longer than I care to admit sometimes, but I'm getting to the point where I can't hide that very well anymore. I've actually been in the 911 industry from the commercial side for 34 years. I even spent 4 years with OnStar, and now I've been with TCS for about 7 months now. So I've seen a lot of the history of the 911 industry on a first-hand basis. Next slide, please. And what I'd like to do today is to talk about the changes that are taking place not only from the PSAP perspective, but from the industry, the commercial suppliers that are part of the 911 community that will be a part of NextGen 911. Just to spend just a very brief point of time on this particular slide, the basic 911 as a technology has been around since 1968. I was not in the 911 business in 1968. I was still in junior high school, but I have been around from the start of the enhanced 911 phase that in the Midwest area where I was working started in the mid-1980s. It varies around the country from a timing perspective, but that's about a good starting point for Enhanced 911. But the point is that from a supplier perspective, for both Basic 911 in 1968 and then with Enhanced 911, the only suppliers that a PSAP could go to for that business were the local telephone companies. And they were regulated by the Public Utilities Commissions, and they had to operate and provide their services via tariffs and so forth. With Enhanced 911 and the different technology that was employed there, we saw the beginning of new players emerging in the marketplace. Initially, even the answering equipment at the PSAPs came from the telephone companies. That was loosened, and we started to see third-party CPE providers that would actually deal and contract with the PSAPs in a lot of cases and sell their answering equipment. Same thing happened with some database services. A lot of the telephone companies contracted with Intrado early on to build their 911 databases and to provide that service for the PSAPs. And the Enhanced 911 system was modified, as was alluded to earlier, to accept cellular and wireless calls in the 1998 timeframe, and more recently the voice over IP providers required another modification to the 911 system, Enhanced 911. With NextGen 911 and the new technology and the new emerging players in the NextGen marketplace, the services needed to provide NextGen 911 are no longer restricted to a local telephone company. As a PSAP or a 911 agency, you have choices for the people that you contract with to do piece parts or the whole system for you. And as far as the new providers are concerned, we're seeing a lot of non-traditional 911 providers that are entering the marketplace that bring a varying level of skills and experience in areas like those you see listed there. The IP providers, satellite service providers, you'll see technology aggregators that function to go out and bring in different disciplines for the piece parts that are needed to make NextGen 911 work. And the other thing that's significant about NextGen is that for the first time from a state and local government perspective, there is a role that can be played by your local and state government IT departments. As you'll see in a later slide, some of the functional elements that are required to make NextGen work can be provided by state and local government. If you have that expertise in-house, you can certainly utilize that. Next slide, please. Future of 911 services. This is one of the repeat slides. It covers just about everything we talked about this morning. In the upper right-hand corner, you'll see the hand. It's hard to see that, but that actually has a keypad, if you will, in the hand, and it would be used as a cell phone. That's not that far-fetched. As Dr. Dunford mentioned today, with the medically implanted devices that are being used right now and will be in the near future, it's not going to be too long before those devices will be capable of making a 911 call. If something goes wrong with your heart pump, it'll call 911 for you. And for several years, we've been hearing stories about sensors being built into clothing, to monitor your heart and your temperature and things like that. That's not Star Wars kinds of stuff. That's really here. And it won't be too long before they'll be coming to the PSAPs wanting to send their calls directly to you too. So that's why NextGen is so exciting, because the Internet Protocol technology will allow us to accommodate any device, anytime, anywhere, as was mentioned earlier. Next slide, please. And next slide. I think that's just an active thing there. Yep. This I won't spend a lot of time on. This has been covered several presentations today. These are the future standard-based features for NextGen 911. Next slide. When you take a look at the cloud in the middle of this diagram, these are the functional elements that are required to make NextGen 911 work. A lot of the PSAPs believe that NextGen 911, all that really means is that they need to have an IP backbone to drive the system, and then they have to have answering equipment in their PSAP that's capable of receiving IP technology. That's not the case. Everything that you see in the middle there, those are functional elements that have to be provided. They, in effect, are replacing the functionality of the enhanced 911 system. And it's these new emerging players in the marketplace that are providing either all of those or some of those or one of those services. And these are the types of things that the PSAP agency, the decision makers at the PSAP, will be able to pick and choose among the new players in the marketplace where they go for those respective services. And as I mentioned earlier, some of those services could be provided in-house. Okay. Next slide, please. From an industry perspective, the first issue that I list there is certainly not unique to the industry. The PSAPs, this is a major issue, and it's the funding model utilized around the country to pay for the 911 services. It's obviously in need of updating. It's a major political issue. I'll just leave it by saying that it's my personal belief as a member of the State of Michigan 911 Committee that any commercial enterprise that can access 911 should be sharing the cost of providing the 911 service. So if your state legislation and regulation allows it, surcharges should be applied equally, I would believe. The other thing about state legislation and regulation that needs to be addressed from an industry perspective is that when the original 911 laws and the PUC regulations were written, a lot of those documents and laws were written in such a way as to restrict who could be a player in the 911 marketplace. In order for the PSAPs to fully utilize the advantages of expanded competition in the marketplace, you need to be sure that people have a level playing field from a legislative and a regulatory perspective. Another major issue that's closely related to both legislation and regulation is liability protection. Through the telephone company tariffs and the 911 laws, the traditional 911 players are given liability protection through those documents or contracts. That same level of protection needs to be extended to the new players in the 911 marketplace. Okay, next slide, please. Benefits of 911, I will repeat some of this just because it bears repeating. The best feature for NextGen 911 is that it is going to mainstream 911 technology. And for two reasons, it's mainstreaming it. Obviously, first and foremost, because the public expects us to be able to communicate with them the way they communicate with each other. Okay? Whether that's a telephone, a landline phone, a wireless phone, a VoIP phone, a game console, a television set, or a heart pump, in the future. If they're using it, they think you have it too. They see it on TV shows and movies, and they don't understand that they can't text, for example, to you guys. The other thing that's important about mainstreaming the technology is that due to the change in the marketplace and the emergence of these new players, it should translate into current technology being available to the PSAPs quicker. It was mentioned earlier that the 911 network that we're using today is based on 40-year-old technology. That is absolutely true. So going forward, based on increased competition, that process should move a lot quicker. The other thing that's I want to bring up as far as a benefit of NextGen 911 is the fact that NextGen 911, it's IP technology is not a new technology. It's been around. The industry, other commercial industries have been using it for years. The public is using it in their texting and their videoing and so forth. It is a new application for 911, but it is not new technology. So when we talk about NextGen 911 and you talk about the IP networks and so forth, the thing to remember is that NextGen is an application for 911, but it can be shared by other state and local government agencies. And if that is the case and political concerns can be overcome, then the cost of operating the system should be spread among those that are participating in it. It's no longer restricted. It's not a closed system like it is today. With the 6,500 PSAPs that we have around the country, they're all relatively, for lack of a better word, they are closed systems. We have 6,500 different 911 systems around the country. With NextGen, theoretically, at some point, assuming that everything is built utilizing common standards and so forth, everything with NextGen should be plug and play, and at some point in the future, it should be one national system. Regardless of who funds it, eventually it will function as a national system. That's it.
I want to talk first, again in line with the agenda that was set forth is, where do you see the industry today? Where do you see it going or moving, or how do you see it moving forward? And what's some of the challenges or content related to that? Today, like was said earlier, is that 911 is not broken in California or anywhere else in the United States. It's worked very well for nearly 40 years. But it is geographically centered or geographically siloed, in a way isolated across the country and across the state of California. And it does basically deliver voice and rudimentary TDD, TTY, for the impaired community or those who need it. It is based predominantly on proprietary hardware or very specialized niche industry type hardware that you can only buy in one place under one type of purchase vehicle, which means that you're sort of held captive to an extent as that upgrade or migration cycle, which typically runs 7 to 10 years with most of us with CP equipment today. It is based almost entirely nationally upon analog technology, and the call routing is sort of based on those same set of silos, or that same little geographic piece of the world that 911 center covers. So that's the status of where the systems are today. So then in comes in next generation 911, and we hear this as a buzz term, and I have sales in my title, so understand that it's integral to what I do, but it is a marketing term. The next generation, it sounds real good, it looks really good on cut sheets and such, but it's really tough to nail down and define. So along with this, the general expectations, which you've probably heard in prior presentations here today, and everything else related to the next generation is, so what's that really mean? Well, the general going expectation seems to be that it's more data, like was just discussed in the last presentation, to move from the caller origination point or the caller to the receipt agency for the call and subsequently the responder, to allow for sort of a richer, more intelligent than just say voice and rudimentary location data exchange or experience between need and responders to an emergency incident. It's also to allow other ancillary access, so hazardous material, foreign language translation, different things like that sort of fold into that OnStar type, ATX type model as well. But the underlying intent, sort of the backbone of this, is to accept universal calls into the same homogeneous network, both on a state and a national level, and be able to route and transfer and move those calls and data around the country or around your jurisdiction, being California, in the same fashion, in a standardized fashion, in a homogeneous fashion. That is the intent. So so how we accomplish that is that we start to ingest data on the origination points that we've never thought about or never been able to, prior to this point. And so that's where this next generation terminology comes about. So to get a little bit deeper into what that is that next generation is this nice blessing of a marketing term given to us, the vendors, right? So what the National Emergency Number Association, in conjunction with a number of other standards organizations, sort of banded together, and Nina charted this course of a series of interim solutions or tiers or levels of readiness to approach next generation, with the pinnacle of that being interim 3 or I3, Nina I3, which essentially lays out a blueprint for an end-to-end, from origin to call taker, IP-based backbone to ingest calls, move them around, route them on various components, deliver them with the data, or deliver them in a fashion that they can then retrieve all of this rich data and have this richer experience. So practical benefits. So to get back out of the clouds a minute and talk about, so what does this really mean? The number one, if there's one component of the next generation type of network as we see it moving forward, is the fact that the location can and will be delivered with the call, not determined by the CPE equipment once the call is delivered to its final point of answer, as is the case today. Along with that is this richer ingest of information, which means text, both instant messaging, SMS, other type of text type messaging, to ingest video, images, whether streaming or static, the telematics that we discussed earlier, and then wireless calls which is one of the things unique to California. You have a very dense population base in many areas. You have a high volume of wireless calls, so you deal with abandoned calls or misrouted calls, more so in California than I guess from my purview anywhere in the country, other than the extreme East Coast, where it's really, really dense. And so what's happening is these cell towers are all over your state, and they take calls based on where the tower physically is located and deliver them to a PSAP, typically based on that same location. Moving to the next generation, we will have the capability to route the call based on the location of the caller, regardless of what cell face they're hitting. So if you sort of take that 3 steps forward, imagine how that can affect the congestion that California PSAPs and agencies deal with today. Is that, they just happen to have the real estate that has this one tower which covers 4 or 5 different jurisdictions, and they're the lucky agency that gets to answer it. If we could sort of preempt that, which we can, based on the next generation model, and route those calls based on where they belong, not where the tower is that's receiving the call sits. So to accomplish that, we have to deploy what's called, not to get technical, which I try to avoid, it's called an ECRF, or lost routing, which is GIS-based routing, as opposed to a flat table that sits in a telco office or selective router today. We'll be able to do selective routing based on essentially point and polygon-like lookup. So if imagine, if you will, throwing darts at a dartboard, the various colors represent score, the various colors will represent your jurisdiction, and then we'll dictate where the call gets transferred to or sent to. The other hallmarks woven into Nina's document, if you read it, it outlines that the equipment should not be proprietary. The equipment, the gear, the stuff should be open market type of hardware. So common off the shelf, things that can be purchased and maintained in a competitive market by lower level skill sets, if you will. So more so of common off the shelf skill sets as opposed to highly specialized. You can only get it from a microdata or one of our competitors type of approach. The intent of NINA is to commoditize this and flatten it so that it's not this high-priced specialized infrastructure. So to just summarize with 5 quick points here, is that there is a roadmap that has been established, and it is, the course is set by NINA, specifically the I3 standard. One thing that is common misconception that I see is people associate, just because something is IP, they automatically assume that it's next generation capable or ready. So IP does not equate with NINA I3. So you can have one and not the other. Any solution proposed should be on this common off-the-shelf type equipment to the extent possible by the system design. And also any solution proposed should be IP network agnostic, meaning that the IP transport to get data or calls from point A to point B should be commonly available from, say, an AT&T or a Verizon or a Comcast or Time Warner or whoever the carrier could be. It could also be fiber, lease line, microwave, or some other method of RF transport.
What I'm going to be talking about today is just sharing a little bit about how oblique aerial imagery and GIS and mapping applications work in emergency 911 and next generation 911. I've actually been in the GIS world for about 15 years and also been in the remote sensing, which is actually imagery. Let's go to the next slide, please. So before we talk about oblique imagery, let's talk a little bit about ortho imagery. And ortho imagery is what probably most of us are familiar with. It's that straight down look. Typically when you look at Google or Bing or something like that, a mapping component like that, you want to see your house. And what you'll see is the roof. You won't see anything else, but you'll see the roof. Well, this is actually an example of an ortho. A little rough, but nonetheless an ortho. What is it? Gosh, I've heard it could be a doorknob, maybe it's a yo-yo, maybe it's a big round cut diamond, but it's kind of difficult to tell what it is. Could be a glass. If it is a glass, what kind of glass is it? Is it a wine glass? Is it a water glass? Let's go to the next slide. Well, with oblique imagery, you can actually see the sides of different structures and the sides of things. So we can actually see, in this case, what it is. In this case is a water glass. We can tell if there's actually liquid in it. And that's really what the power of oblique imagery does. Let's go to the next slide. So typically people will ask, well, how is oblique imagery captured? And how it's typically captured is small planes, and they're flying at low altitudes, anywhere from 2,500 to maybe 8,500 feet above ground. And there's a camera system in each plane. And what that camera system, there's 5 cameras. It'll give you that straight down shot, and then it'll also give you the ability to look from north, south, east, and west. And that's what, that's basically, you know, you hear satellites, and, but typically it's, again, with small aircraft. Let's go to the next slide. So how's it being used currently in a 911 environment, in an E911 environment? Well, it's being used for landmarking. It's used to determine and to confirm caller locations, event locations. Typically, you know, you get a lot of situations where the call location is different than the event location through either landline or wireless. It's also used for lat-long determination, directional guidance to first responders, and a few other things. Let's go to the next slide, please. So here's an example of a wireless call, a car crash site. And this is used for landmarking. Might be a little tough to see, but we've got a car that calls the 911 center and says, I've been in an accident. And so the dispatcher, if it's a wireless call, each handset has that lat-long chip, or, you know, if it's a newer one, it'll have that lat-long chip in it. But, you know, they're not always accurate. They might be 200 meters off. If it's in a phase 2 situation, that ring, that orange or that yellow circle we're looking at, puts it off a little bit. So you've got, you know, a little bit of an area to look at. What the dispatcher can do in this case is they can look at the oblique imagery, and they can start to ask questions. Well, what do you see? Do you see any houses? No, there's a house that I can see, but it's surrounded by bushes, and I can't see an address. Are you next to anything? Well, I'm in back of a strip mall. Can you see any restaurants? Can you see any businesses? Yeah, across a main intersection, I see a Friendly's restaurant. Do you see anything else? Well, I see a communication tower. And so the dispatcher, in this case, can start to gather information about where this call is coming from, and then it gives them the ability to, you know, potentially send the officer or the responding unit to the correct location. Let's go to the next slide. Here's a case, kind of in the lower part of the image. We have an address here. And so this is a call location. The neighbor's calling, it's late at night, and saying that I think somebody's breaking into my neighbor's house. You know, I'm looking out my back kitchen, and I can see across the yard, and there looks like somebody's breaking in. The dispatcher can ask some questions. Well, can you tell me a little bit about your neighbor's house? How many stories is it? How many? What color is the house? Is there a deck in the back? Are there any toys or anything like that in the back? When you're looking straight out your back window, is it to the left or is it to the right? And so, again, the dispatcher is able to glean some information. And let's go to the next slide. And they can determine that this is, in fact, where the event's actually happening. So instead of sending the responding unit to the call location, they can actually send to the event location. Let's go to the next slide. Keyhole lots. We've got an address here on 3rd Street, 1817, and we have maybe 1809. So the dispatcher, and the incident's actually happening at 1815, which is right here. So the officer's going down the street here, and they're trying to figure out, I can't find that address. And the dispatcher can say, well, you know, taking a look at the imagery that we've got here, you should, in between 1817 and 1809, you should see there's a driveway, and it actually goes, it sets back to where the actual location of the call is. And so this is another example of how oblique imagery is being used in this environment. Let's go to the next slide, please. This is a good one. So you get a call, and there's actually a fire in this structure. The caller says, yes, I'm located on the 3rd floor. And dispatcher says, okay, great, we'll send a unit, we've got an address, all that good stuff. Let's go to the next slide. This is the back of the building. And so looking at it from an oblique perspective, where is that 3rd floor? The 3rd floor might be different on one side of the structure as opposed to the other side of the structure. And again, this is the power of the oblique imagery, giving the ability to see all sides. Let's go to the next slide, please. School protection and response. You know, like a lot of people, and I know a previous, somebody was talking about this, about texting. You know, when 10 years ago, I thought I might be learning a new language, and I'd like to learn a new language. I never thought it'd be texting. You know, my daughters text all the time, and half the time I have no idea what they're saying. Here's a situation where you can take a floor plan, and you can actually attach it to this oblique imagery. And if you have a school protection plan or a school response, and you're getting all kinds of texts and things, the only thing you might be able to determine is a cafeteria. This is something that you can actually take a look, and you can actually set the floor plan to the image. Let's go to the next one, please. Here's an example of GIS data. This GIS data has been overlaid in the, on the image, and this will actually tell you specific locations of classrooms, of the cafeteria, maybe the auditorium. Let's go to the next slide. You can actually link up video, and so you could actually have pictures and video of the internal structure of the building that you're looking at, in this case a cafeteria. Let's take a look at the next. Determining lat long coordinates. I know that a big issue is trying to figure out specifically where somebody is, or maybe when you're sending in units for rescue, that kind of thing, what is the lat long? Well, this imagery is georeferenced, and so what that means is that you can click anywhere on a map, and what it'll do is it'll bring up the image associated with where you've clicked. In this case, what you can do is you can click on maybe a potential landing area for a helicopter. You could tell that helicopter there are power lines, there are light poles, whatever it may be. And so this kind of gives the dispatcher the ability to express this information to maybe an air unit. Let's go to the next slide, please. The imagery here gives you greater detail, so you can actually see maybe a larger area, for blocking off streets, things like that. Let's go to the next slide. Here's an example of a house that's set back. We've got our address, maybe right back in here, and I know it's kind of tough with my pointer here, but there's the entrance, but that house is way back there. The dispatcher could actually, with this technology, make a measurement and tell you how far that house is back off the street. Let's go to the next slide, please. Here's oblique imagery with GIS data, and probably heard a lot about GIS data, right? GIS, Geographic Information System. And what you can do is you can take that GIS data and you can overlay it. I've got address points here in yellow of each structure. And you've got parcel lines and as well as street center lines and such. So have I hit my number yet? Just about? Okay, so why don't we go to the next slide? And this is an example of how imagery is used in a 911 environment. This is a MapCAD system, and so the imagery is located there. Let's go to the next one. And then Pictometry is the company that I work for, and we we've worked with the Department of Transportation on a proof of concept on IP-based technologies to bring this imagery into PSAPs. Let's go to the last slide if we could. This is an example of where imagery is in the state of California at this point, and there is ranging historical data. I know the San Diego data is a few years old, but Los Angeles County, for instance, we're flying it right now. So there's a wide range of data that's available currently. So that's about it.